Good morning, everybody. Our research is the impact of crash characteristics, safety accessories on injury patterns among motorcycle users taken to reduce Senarathne law. And we all know motorcycles are a popular mode of transport in Sri Lanka because it's affordable and it's economic and it's popular. So, according to the police archives, approximately 25% of all traffic accidents involve motorcycles. And recently there has been a significant increase in mortality and morbidity from motorcycle accidents in Sri Lanka. And the injury patterns of these different motorcycle riders differ with crash characteristics and the safety equipment they have been wearing. So this graph shows the motorcycle accidents and deaths of the first 6 months of 2015 and 2016. In 2015, as we can see, there has been 622 fatal accidents, whereas 651 has been killed in these motorcycle accidents. In 2016, the numbers have gone up, 666 fatal accidents and 686 has been killed in the accidents. So the numbers are going up, it seems. The objective of this study it was conducted to understand the factors related to the motorcycle and factors related to the road, as well as the rider, which determines the injury patterns of the victims. Identifying these injury patterns commonly seen in motorcycle riders and passengers was also intended. To study population, we recruited motorcycle users who were admitted to hospital therapy following motorcycle accidents, and we collected data prospectively over 6 months of period from January 2015. On whom this medical examination was performed by the engineers. And this was a cross-sectional study. We recruited patients after motorcycle accidents, so it was cross-sectional, and data was collected prospectively for 6 months using interview administered questionnaire. And data was processed and analyzed using SPSS 20.2. So the results are as follows. Total number of subjects, 272, 85.6% being male and 14.3% being female. Out of these victims, 194 people were riders, whereas 78 were female riders. And this graph shows the age groups of the motorcyclists, majority falling into the age category of 21 to 40, that's 55.9%. And the type of the incident. Popular belief is that the accidents are much more higher in the peak hours and when it's night, but it seems it's not true. In the daytime, from 6:01 a.m. to 6 p.m., the percentage is 49.3, whereas at night, 6 p.m. to 6 a.m. in the morning, the percentage is 50.7. So it's much more similar. The condition of the road. These accidents took place in tar roads, and 91.2% took place in tar roads, concrete roads, and roads and mountains. That is very little amount of accidents. So let's take a deep look. Safety accessories. A standard motorcycle helmet should contain, it is not that clear. It should contain an impact-absorbing liner and a rigid outer shell, whereas a comfortable inner padding, and there has to be a visor, and the motorcyclist's vision should not be obscured. Even though this is a full-face helmet, the vision should not be obscured. That should be made according to standards. And in our study, the results, 88.6% of the victims were wearing helmets at the time of the incident, and 9.9% of the victims were wearing full-face helmets, and 56.6% of bicycles had a crash bar. Out of all the subjects, 9.1% were wearing jackets, whereas only 4 riders were wearing gloves. Let's move to the type of injuries. Out of all the injured motorcyclists, we could see abrasions of 189 patients and fractures of 123 patients, whereas lacerations of 109 patients. these are the patients. We got the patients at least one operation and at least one destination. So we categorize them into these categories. So 189 people had operations, and also there were cut injuries, 5 people, fractures were there, 123 patients. So anatomical areas where the injuries were located. It seems 46 people suffered at least one head injury and 106 people suffered at least one facial injury. It seems mostly injured area are the limbs. Upper limb injuries 174 people. There are 149 people with lower limb injuries. Severity of injuries were assessed using the category of hurt. 1.9% of the injuries fell into non-grievous form of hurt, and 47.1 fell into grievous category. And there were 5.5 of end injury class, and relatively of original cause of nature 5.5. Let's move on to the discussion. Most of the riders are males, and majority of the victims were between 21 to 40 years. Most of the incidents took place on dark roads, and the most common injury type was abrasions, and the commonly affected anatomical area was upper and lower limbs. This is the important part, impact of safety accessories. After analyzing the data, wearing helmets provided protection against head injuries with a p-value of 0.020. And full-face helmets provide protection from facial injuries than normal helmets with a p-value of 0.037. And wearing jackets, even though the jackets are very much prone to damage in the crashes, wearing jackets provide protection against chest injuries with a p-value of 0.030. In conclusion, victims from motorcycle accidents suffered multiple types of injuries, majority being fall into the category of grievous hurt. And measures should be taken to make the safety accessories popular among the motorcycles, because only 4 riders are wearing gloves and not much of riders are wearing jackets as well. So safety accessories should be standardized and developed to provide a better protection against injuries.